Welcome to our presentation on Hospital Accreditation and Quality Professionalism, brought to you by CDG Training Private Limited. Let's explore how accreditation enhances healthcare quality. Modern hospitals are expected to deliver efficient, ethical, and high-quality healthcare services. Trust, safety, and excellence are the pillars of healthcare quality excellence. Healthcare quality is crucial in managing surgeries, emergencies, and patient care. Quality systems help reduce risks and maintain consistent standards across all departments. Hospital accreditation is a formal process evaluating healthcare organizations against quality benchmarks. It involves evaluation, assessment, demonstration, and recognition. Healthcare accreditation is growing globally, with organizations like JCI and NABH leading the way. These bodies help improve international patient safety and care quality. Healthcare quality professionals ensure safer hospitals through audits, patient safety systems, policy management, and staff training. They are essential to maintaining standards. Patient safety is central to quality management. Professionals help prevent harm by identifying risks, improving processes, and building a culture of safety. Hospitals operate through complex systems involving clinical teams, diagnostics, administration, and digital systems. Quality management aligns these systems for better outcomes. Technology is transforming healthcare quality with real-time monitoring, AI, and automated compliance reporting, making hospitals safer and more efficient. Accreditation is about continuous improvement, requiring ongoing assessment, implementation, and review to maintain high standards in healthcare. The demand for quality professionals is growing across hospitals, accreditation bodies, insurance organizations, government agencies, and healthcare consultants. This course will explore modern healthcare quality systems, including accreditation frameworks, patient safety systems, policy management, and emergency preparedness. Join us on a journey into healthcare excellence, focusing on building trust, protecting patients, and strengthening healthcare organizations for the future. An exploration of how accreditation frameworks, patient safety systems, and quality management shape modern healthcare organizations worldwide. Modern hospitals operate in highly demanding environments where patients expect safe treatment, fast service, accurate diagnosis, clean facilities, transparent communication, and high-quality care. Today's patients evaluate hospitals based not only on treatment outcomes, but on the entire care experience. Hospitals must deliver consistent experiences across every department to maintain patient trust. Healthcare organizations manage thousands of operational processes every day, making system reliability extremely important. A single lapse can cascade into serious patient harm. Modern hospitals include doctors, nurses, laboratories, pharmacies, emergency departments, intensive care units, digital systems, biomedical teams, administrators, and support services working together continuously. Governments and healthcare organizations worldwide increasingly focus on patient safety, healthcare transparency, infection prevention, operational accountability, and quality improvement. Hospital accreditation is a structured evaluation process that measures whether healthcare organizations meet recognized quality and safety standards. Patients often feel more confident choosing hospitals that follow recognized healthcare quality standards. Accreditation demonstrates that a hospital has implemented structured systems focused on patient safety, quality improvement, and operational accountability. Organizations such as Joint Commission International, JCI, NABH, ISO, and national healthcare authorities help establish healthcare quality expectations globally. Accreditation systems focus heavily on reducing preventable harm. Healthcare organizations monitor safety processes continuously, not as a compliance exercise, but as a fundamental commitment to every patient. Hospitals with organized quality systems often reduce delays, improve communication, strengthen documentation accuracy, and coordinate departments more effectively. Healthcare quality is not a one-time achievement. Hospitals continuously review policies, audit processes, staff performance, patient feedback, safety incidents, and operational data to improve systems over time. The COVID-19 pandemic highlighted the importance of infection control, emergency preparedness, staff safety, isolation systems, and healthcare operational resilience. Hospitals increasingly use healthcare analytics, electronic medical records, AI systems, patient safety dashboards, and digital monitoring tools to improve quality and performance. An international hospital identifies recurring delays and communication gaps in operating room preparation. The quality management team takes structured action to address the root causes. High-quality healthcare organizations often improve patient retention, operational efficiency, and long-term financial stability simultaneously. Quality management now supports both clinical and business performance. Healthcare quality systems cannot function effectively without staff participation. Quality culture must exist throughout the entire organization, from the boardroom to the bedside. Medical tourism and digital healthcare platforms allow patients to compare hospitals across countries more easily than ever before. Hospitals increasingly compete based on accreditation status, patient reviews, infection rates, technology, and service quality. Hospitals increasingly require trained professionals who understand audits, compliance systems, patient safety programs, documentation management, quality indicators, and accreditation standards. Structured quality systems encourage hospitals to monitor performance continuously, identify operational weaknesses, respond to incidents, and maintain standardized healthcare practices. Accreditation and healthcare quality systems influence nearly every aspect of hospital operations, from patient safety and infection control to communication, documentation, leadership, and digital systems. Dive into the structured frameworks that help hospitals deliver consistent, safe, and effective care across every department and shift. In the complex environment of hospitals, structured management systems are crucial for maintaining consistent quality standards. They help organize processes, reduce risks, and improve performance systematically. A healthcare quality management system, or QMS, is a structured framework used to monitor, improve, and standardize healthcare operations, ensuring patient safety, infection control, documentation, and regulatory compliance. Quality management in healthcare is about ongoing improvement. By monitoring performance, identifying weaknesses, and correcting gaps, hospitals can enhance patient safety and operational efficiency. Standardization in healthcare reduces confusion and preventable errors, ensuring reliable care delivery. Consistent procedures, reduced errors, and reliable outcomes are the goals of quality systems. Healthcare quality encompasses patient safety, clinical effectiveness, operational efficiency, communication quality, infection prevention, and patient experience. Balancing these dimensions is key to maintaining high standards. Leadership is vital in establishing and maintaining quality systems. Strong leadership ensures clear goals, accountability, and a culture of safety within healthcare organizations. Policies and standard operating procedures guide healthcare activities, reducing confusion and improving reliability. They ensure accurate patient identification, medication management, infection control, and emergency response. Accurate documentation is crucial for quality management, transforming observations into actionable intelligence. It strengthens accountability and compliance, leading to evidence-based improvements. Healthcare quality management systems prioritize patient safety by preventing harm through medication safety, infection prevention, surgical safety, and incident reporting. Effective risk management in healthcare involves identifying potential hazards, analyzing root causes, and implementing corrective actions to prevent issues before they arise. Internal audits ensure compliance with hospital policies and procedures, identifying gaps and implementing corrective actions for continuous quality improvement. Hospitals use data analytics to monitor quality performance, improving healthcare outcomes through informed decision-making. Key performance indicators guide these efforts. Continuous education in healthcare strengthens organizational quality culture, transforming individual competence into collective excellence. Training covers safety, infection control, and more. A structured quality management system helps reduce medication errors through barcode systems, updated SOPs, and staff retraining, demonstrating measurable improvements. Effective communication is essential for safe and coordinated healthcare operations, reducing incidents and improving patient safety. Digital transformation in healthcare quality systems enables faster issue identification and improved decision-making through electronic records, AI, and predictive analytics. A strong quality culture involves everyone in a hospital, from clinical staff to leadership, ensuring accountability and improvement in patient care. Accreditation standards depend on effective quality management systems, which provide the operational foundation for successful accreditation. Healthcare quality is continuously evolving with regulatory changes, patient expectations, and technological advancements, requiring adaptability while maintaining consistency and safety. International frameworks provide benchmarks for hospitals to measure performance against world-class standards, essential for modern healthcare operations. Dive into a comprehensive guide on international healthcare accreditation standards and frameworks, shaping quality, safety, and excellence worldwide. Hospitals worldwide may differ, but patients expect safe and reliable care. International standards help create consistent quality expectations and structured systems, ensuring universal patient safety. Accreditation frameworks organize policies, emergency preparedness, and quality monitoring. They ensure hospitals maintain consistency and improve operational systems. Accreditation bodies evaluate patient safety, medication management, emergency response, leadership, infection prevention, and staff competency to ensure safe operations. Joint Commission International is renowned for its focus on patient safety, quality improvement, leadership accountability, and global reputation. The National Accreditation Board for Hospitals in India emphasizes structured quality systems and patient-centered care, enhancing hospital operations. ISO standards enhance healthcare quality by improving processes, risk management, information security, and operational controls. Accreditation is more than paperwork. It evaluates how hospitals operate in real environments, focusing on patient care, infection control, and emergency response. Patient safety remains a universal priority across all accreditation systems, focusing on medication safety, incident reporting, surgical safety, and infection prevention. Accreditation is not a one-time achievement. Continuous improvement through monitoring, audits, and retraining is essential for maintaining high standards. Accreditation bodies assess the culture of an organization, focusing on leadership, teamwork, safety culture, and accountability to ensure quality performance. Accredited hospitals inspire confidence in international patients, offering recognized quality, reducing anxiety, and providing a competitive advantage. Insurance companies prefer hospitals with recognized accreditation, ensuring operational reliability, patient safety, and network access. Healthcare accreditation systems vary worldwide. Understanding both local and international frameworks is crucial for healthcare quality professionals. A hospital's journey to international accreditation involves infection control, documentation updates, staff training, audits, and achieving accreditation. Well-structured documentation demonstrates accountability and supports consistency across healthcare operations, detailing policies, audits, and safety programs. Continuous education strengthens organizational readiness, ensuring staff understand and apply accreditation standards effectively. Hospitals with strong accreditation systems improve trust, operational efficiency, insurance networks, and reach in medical tourism. Successful accreditation involves everyone in the hospital, from leadership to support staff, ensuring coordinated commitment to quality systems. Healthcare standards evolve with new technologies, cybersecurity risks, patient expectations, and infection threats, requiring ongoing adaptation. Patient safety is central to accreditation, involving risk management, harm prevention, communication improvement, and safety systems across departments. Explore how healthcare organizations identify, manage, and reduce risks to protect patients, staff, and operational integrity. Patient safety is essential for improving health outcomes and protecting human life. Healthcare environments involve risks like medication errors and infections. Safety systems help reduce harm and build trust. Hospitals operate continuously, managing risks through clinical and operational activities. Without safety systems, small failures can have serious consequences. Services like surgeries and diagnostics are delivered simultaneously. Risk management involves identifying, analyzing, controlling, and monitoring potential threats to patient safety. It includes identifying risks, analyzing their severity, controlling exposure, and monitoring systems. Incorrect patient identification can lead to serious errors. Accurate identification is a key safety practice. Methods like wristbands and barcode scanning help prevent adverse events. Medication errors can occur due to various mistakes. Implementing safety systems like double verification and barcode scanning reduces risks at every stage of medication management. Infections spread through poor hygiene and inadequate protocols. Programs like hand hygiene and PPE usage are critical. Infection prevention became even more vital during the COVID-19 pandemic. Miscommunication can lead to treatment delays and errors. Hospitals strengthen communication with standardized reporting and digital records. Clear communication improves patient safety. Surgical procedures involve multiple risks. Structured safety systems like checklists and team pauses are essential to improve safety and reduce errors in the operating room. Falls are a significant risk, especially for the elderly and post-surgical patients. Prevention strategies include risk assessments and safety equipment to reduce fall incidents. Hospitals encourage staff to report safety concerns without fear. This culture of transparency helps identify patterns and implement improvements, strengthening resilience and preventing harm. When incidents occur, hospitals investigate underlying causes. Root cause analysis identifies what truly went wrong, helping organizations improve systems and reduce future risks. Hospitals must be ready for fires, disasters, and emergencies. Plans and training ensure operations continue and patient safety is maintained during crises. Digital systems and AI improve patient safety by detecting risks early. Automated alerts and integrated data systems support proactive risk management. Structured risk management improves healthcare quality. Actions like enhanced monitoring and sterilization protocols lead to significant reductions in infection rates. Patient safety is everyone's responsibility. A strong safety culture encourages accountability and teamwork, improving safety at every level of the organization. Active patient participation enhances safety. Patients can ask questions, report concerns, and engage in their care, helping identify risks early. Accreditation evaluates safety performance across domains like patient identification and infection prevention. Strong performance influences outcomes and reputation. Hospitals track safety indicators to improve systems. Data-driven management supports risk reduction and operational improvement. New diseases, cybersecurity threats, and staffing shortages increase healthcare risks. Future safety will depend on proactive risk management. Strong patient safety systems depend on clear policies and standardized procedures. Consistency and compliance ensure safety standards are applied uniformly. Explore how structured operational systems, standardized procedures, and controlled documentation drive safety, compliance, and quality in modern healthcare organizations. Modern hospitals manage a wide range of clinical and administrative activities daily. From surgeries to billing, structured coordination is essential for maintaining safety and consistency. Hospital policies are official guidelines that define how healthcare activities should be managed, creating structure across the organization. They cover patient care, communication, and more. Standard operating procedures, or SOPs, provide step-by-step instructions for specific tasks, ensuring consistency and reliability across departments. Clear operational procedures help reduce medication errors, infection risks, and communication failures, supporting both clinical quality and patient protection. Different hospital departments require specific workflows to maintain safety and healthcare standards, from emergency response to rehabilitation. Proper documentation control prevents operational confusion, reducing risks for patients and staff by managing policies, forms, and compliance documents effectively. Document version control ensures that staff always use the latest approved procedures, reducing operational risk and confusion. Healthcare workers need easy access to policies to ensure compliance and efficiency. Digital systems provide cloud-based access, searchable libraries, and update notifications. Accreditation bodies evaluate whether hospitals maintain structured policies and procedures, ensuring operational consistency through organized records and documentation. Clinical SOPs standardize processes across patient care activities, reducing variation and improving safety outcomes. Proper documentation strengthens organizational accountability and transparency, enabling performance tracking and compliance monitoring. Staff training is essential for effective SOP implementation, ensuring that procedures are applied correctly and consistently across departments. Missing records or unclear procedures can lead to serious risks, including medication errors and accreditation threats. Strong documentation helps prevent these issues. A hospital identified gaps in emergency response procedures and took action to improve performance, demonstrating the value of structured SOPs. Digital transformation is reshaping healthcare documentation management, making systems faster, safer, and more accessible. Hospitals update policies regularly to comply with changing regulations and standards, ensuring operational consistency and patient safety. Policies and SOPs help departments coordinate effectively, ensuring patient safety and operational efficiency across the hospital. Quality audits ensure that departments follow approved procedures, identifying gaps and preventing failures before they affect accreditation status. Documentation systems support organizational learning by capturing, analyzing, and improving processes over time, preventing repeated operational failures. Policies and SOPs are effective when supported by strong leadership, accountability, and a quality-focused organizational culture. Explore how leadership and governance frameworks enhance patient safety and organizational excellence in healthcare. In modern hospitals, strong leadership is crucial for maintaining consistent standards and safe operations. Clinical governance builds accountability and improves communication across departments. Clinical governance is a structured system that helps healthcare organizations maintain and improve quality. It encompasses leadership, accountability, patient safety, and continuous improvement. Healthcare organizations must define responsibilities and standards to ensure accountability. Governance frameworks help maintain trust and stability across all levels. Leadership behaviors directly influence patient safety by promoting safety protocols and supporting quality initiatives. Effective leadership improves hospital performance. Clinical governance involves multiple components like quality improvement, risk management, and patient safety, all working together to enhance healthcare delivery. Healthcare must continuously improve. Leaders foster a culture of learning, adaptability, and system improvement to meet evolving demands. Strong communication is vital for leadership in healthcare, ensuring clear and consistent information across all departments. Ethical leadership builds trust by ensuring integrity, fairness, confidentiality, and public confidence in healthcare organizations. Governance systems help manage risk by identifying weaknesses, implementing corrective actions, and building organizational resilience. Committees support hospital governance by coordinating improvement efforts across departments, enhancing decision-making and accountability. Staff engagement strengthens governance systems by improving protocol adherence, reporting, and collaboration, leading to better patient care. Data helps leaders make better decisions by providing comprehensive views of clinical and operational performance in real time. Governance supports accreditation readiness by ensuring leadership involvement, accountability, and quality oversight during surveys. A real-world example shows how leadership and governance improve quality by addressing communication failures and implementing structured improvement initiatives. Crisis situations test leadership most, requiring calm, clear communication, resource allocation, and stability maintenance. Governance requires clear policies and procedures to ensure consistency and accountability across the organization. Healthcare leadership is becoming more technology-driven, with tools like predictive insights, telemedicine, and cybersecurity management enhancing management. Governance builds long-term organizational stability by improving patient trust, operational consistency, and financial performance. Every healthcare professional contributes to governance, maintaining accountability and quality across all roles. Infection prevention is a critical governance priority, involving hygiene monitoring, sterilization standards, and outbreak response. Welcome to Chapter 7, where we delve into infection prevention and control systems. This chapter provides a comprehensive guide to safeguarding patients, staff, and healthcare environments through organized infection prevention strategies. Infection prevention is a fundamental responsibility in healthcare. Hospitals are meant to heal, but they can also expose patients to infections. Strong infection prevention and control systems are crucial to protect patients and maintain safe environments. Healthcare-associated infections pose significant risks to patient safety. They can result from surgeries, contaminated equipment, and poor hygiene. Strong control measures improve patient safety and reduce hospital burdens. Effective infection control requires participation from all organizational levels. Clinical staff, support teams, laboratory technicians, and administrators all play vital roles in applying infection protocols and ensuring accountability. Hand hygiene is one of the most effective safety measures in preventing infections. Simple actions like hand washing can significantly impact patient safety. Hospitals implement various strategies to ensure compliance and effectiveness. Personal protective equipment, including gloves, masks, and face shields, is essential for protecting both staff and patients. Proper use of PPE became especially crucial during the COVID-19 pandemic. Sterilization and disinfection are critical in preventing contamination. Medical instruments and surfaces must be thoroughly cleaned to protect patients and staff from infections. Isolation systems help control the spread of infections by using dedicated spaces and strict protocols. Proper signage and PPE compliance are essential in maintaining these systems effectively. Biomedical waste management is crucial for maintaining safety in healthcare settings. Proper segregation and disposal of infectious waste, sharps, and pathological waste are essential to prevent contamination. Infection surveillance helps hospitals monitor risks by tracking infection rates, analyzing outbreak patterns, and monitoring antibiotic resistance. These systems are vital for effective infection control. Antibiotic stewardship is essential in reducing resistance risks. Overuse of antibiotics can lead to resistance, making infections harder to treat. Responsible prescribing supports long-term healthcare safety. Environmental cleaning is a key part of infection prevention. Regular cleaning of patient rooms, operating theaters, and common areas helps maintain a safe healthcare environment. Continuous training for healthcare workers is vital for maintaining infection prevention standards. Training on hand hygiene, PPE usage, and outbreak management ensures consistent application of protocols. The COVID-19 pandemic changed infection control globally. It highlighted the importance of preparedness and led to strengthened infection prevention infrastructure across healthcare systems. A real-world example of reducing surgical site infections shows how improving sterilization and implementing changes can lead to measurable improvements in patient safety. Infection prevention supports accreditation compliance by ensuring hospitals meet stringent standards. Documented practices in hand hygiene, sterilization, and isolation protocols are crucial for accreditation. Technology plays a significant role in improving infection control monitoring. Digital innovations like AI-powered surveillance and automated hygiene monitoring help identify risks and improve operational responses. Visitors also play a role in infection prevention. Educating them on hygiene practices and access restrictions helps maintain a safe healthcare environment for everyone. Infection outbreaks can affect entire hospital operations, causing disruptions and increased pressure on resources. Strong outbreak management systems are essential for maintaining operational stability. Continuous monitoring is essential for effective infection prevention. Regularly reviewing policies, monitoring trends, and retraining staff help maintain safety and operational consistency. Audits help hospitals measure compliance and improvement in infection prevention practices. Regular audits support accountability and continuous improvement across all departments. Explore how hospitals enhance their systems through structured quality audits and inspections. Hospitals must regularly verify compliance, identify gaps, and drive continuous improvement to meet healthcare quality standards. Healthcare quality audits assess operational consistency, identify improvements, and support accountability across healthcare systems. Audits help improve patient safety by addressing medication handling, infection control, documentation accuracy, and emergency preparedness. Internal audits are conducted by hospital staff to support continuous improvement and ensure readiness for external inspections. External audits evaluate hospital compliance with healthcare standards, ensuring patient safety and quality culture. Quality audits follow a structured methodology to ensure consistency and reliability in evaluations. Documentation is crucial during audits, supporting accreditation and operational accountability. Staff interviews assess awareness of procedures and patient safety, ensuring quality systems are embedded in daily operations. Observation verifies that healthcare practices align with policies, ensuring real-world application of standards. Gap analysis identifies weaknesses in hospital practices, supporting proactive improvement planning. Corrective actions are implemented to resolve issues identified during audits, improving compliance and safety. Follow-up audits verify that corrective actions are effective, ensuring sustained improvement and compliance. Audits encourage accountability by maintaining awareness of standards and fostering a quality culture. A case study shows how audits improve medication safety through structured evaluation and corrective actions. Digital technology transforms healthcare audits, enhancing accuracy and efficiency in quality management. Audits evaluate facility safety, ensuring comprehensive quality across all hospital areas. Staff training supports audit readiness by improving confidence and understanding of healthcare standards. Audit results guide leadership in making informed decisions, prioritizing improvements, and managing risks. Continuous auditing supports accreditation success by ensuring operational consistency and rapid response to compliance gaps. Patient rights and ethical care are essential priorities in healthcare audits, ensuring dignity, privacy, and communication. Explore the essential aspects of patient rights, ethics, and patient-centered care, focusing on human dignity and ethical healthcare delivery. Modern healthcare prioritizes respect, privacy, communication, and patient-centered care to ensure dignified treatment experiences. Patients have the right to safe treatment, informed decisions, and equal access, strengthening trust in healthcare systems. Patient-centered care addresses emotional, cultural, and clinical needs, ensuring a holistic healthcare experience. Effective communication through active listening, clear explanations, and empathy enhances patient satisfaction and trust. Informed consent involves understanding risks and benefits, requiring clear communication beyond just signatures. Hospitals must secure patient information through systems, conduct, and restricted access to maintain confidentiality. Hospitals must provide equal care regardless of background, promoting fairness and equality in healthcare systems. Patient safety is a core responsibility, closely linked with ethical obligations to prevent harm. Respect for cultural differences strengthens healthcare relationships and improves patient outcomes. Emotional care significantly enhances patient satisfaction, reducing fear and loneliness while building confidence. Encouraging patients to engage in healthcare decisions fosters trust and improves long-term outcomes. Listening to patient feedback drives accountability and service quality improvements in healthcare systems. Healthcare professionals navigate complex ethical challenges with professionalism, empathy, and balanced judgment. Patient-centered systems enhance privacy and dignity, improving clinical care experiences. Digital healthcare introduces new ethical responsibilities, requiring strong governance and accountability systems. Healthcare professionals must maintain professionalism and confidentiality, ensuring ethical conduct at all times. Accreditation standards ensure patient rights through privacy systems, communication, informed consent, and ethical care policies. Patient-centered care enhances hospital reputation through positive experiences shared online and globally. Ethical healthcare requires ongoing commitment to communication, training, privacy protection, and patient engagement. Data-driven insights enhance healthcare quality management, focusing on performance metrics and patient satisfaction. Welcome to Chapter 10, where we delve into healthcare indicators, KPIs, and performance measurement. This chapter provides a comprehensive guide to measuring, monitoring, and improving healthcare quality through data-driven performance systems. Modern healthcare relies heavily on measurement. Hospitals cannot improve quality without understanding how systems perform. Key areas include patient safety, staff efficiency, and patient satisfaction. These indicators help organizations measure performance objectively and improve healthcare systems systematically. Healthcare indicators are measurable data points used to evaluate clinical quality, operational efficiency, patient safety, and healthcare outcomes. They transform healthcare performance into measurable, actionable information, helping hospitals monitor trends, identify risks, and support quality improvement initiatives. Key performance indicators, or KPIs, are selected measurements used to track critical organizational goals. They help hospital leadership evaluate whether departments meet expected standards related to safety, quality, and efficiency. KPIs support strategic decision-making at every level of hospital management. Patient safety indicators are essential for monitoring fall incidents, medication errors, infection rates, and emergency response times. These indicators help healthcare organizations identify safety risks and strengthen patient protection systems, ensuring patient safety remains central to healthcare quality management. Infection control indicators help hospital teams monitor risks and improve prevention strategies. Consistent measurement leads to measurable reductions in preventable infections, protecting both patients and healthcare workers. Operational indicators are crucial for measuring efficiency in healthcare. They track patient waiting times, bed occupancy, lab turnaround times, and discharge efficiency, helping hospitals optimize resource allocation and improve service delivery. Patient satisfaction is a key performance area, focusing on communication quality, responsiveness, and overall experience. Hospitals use surveys and feedback systems to measure and improve patient satisfaction, ensuring a holistic approach to patient care. Financial indicators support organizational stability by monitoring billing efficiency, insurance approvals, resource utilization, and revenue performance. These metrics are essential for maintaining financial sustainability and supporting strategic investments in healthcare. Data helps hospitals identify trends and address potential issues before they become systemic failures. By monitoring rising infection rates, increasing complaints, delayed surgeries, and declining satisfaction, hospitals can proactively improve quality and efficiency. Benchmarking allows hospitals to compare performance against national standards and industry targets. It helps identify strengths, weaknesses, and opportunities for improvement, supporting evidence-based healthcare management. Accurate documentation, reliable reporting systems, and data validation processes are essential for maintaining data integrity. High-quality data strengthens operational accountability and patient safety management. Technology, including electronic medical records, AI analytics, digital dashboards, and automated reporting, improves performance monitoring. These tools enhance visibility, efficiency, and decision-making in healthcare management. KPIs are vital for strategic planning, helping hospital leaders prioritize initiatives, allocate resources, and manage operational risks. Performance measurement supports evidence-based healthcare management and improves organizational resilience. A real-world example of reducing emergency department waiting times demonstrates how performance measurement directly supports operational efficiency. By analyzing causes and implementing solutions, hospitals can significantly improve patient flow and satisfaction. Staff performance, including training completion, competency assessments, communication quality, and compliance performance, directly influences healthcare quality. Strong teams improve patient outcomes and ensure adherence to protocols. Accreditation systems depend on measurable data to evaluate healthcare indicators, audit findings, patient safety metrics, and operational performance. Performance measurement supports accreditation readiness and ongoing regulatory compliance. Continuous monitoring improves decision-making by enabling hospitals to detect early signals, analyze in real time, and respond rapidly. Healthcare quality depends heavily on real-time operational awareness. Too many indicators can create confusion. Effective performance systems focus on operational efficiency and strategic healthcare goals, ensuring every metric drives meaningful management action. Data supports continuous healthcare improvement by enabling hospitals to evaluate performance across clinical and operational domains. Measurement creates a cycle of improvement, ensuring patient safety and service quality. Safe healthcare requires strong facility management systems, including safe buildings, emergency systems, and utilities management. These elements ensure uninterrupted clinical operations and protect patients and staff. Chapter 11 focuses on the critical aspects of facility management, safety, and emergency preparedness in healthcare settings. This comprehensive guide aims to maintain safe, resilient, and operationally sound environments. Hospitals operate around the clock, managing patients, equipment, and critical infrastructure. Safety is paramount, directly influencing patient protection and operational continuity. Facility management involves maintaining the hospital's physical environment and safety systems. Key areas include fire safety, water supply, and emergency preparedness. Clean, organized, and secure environments are crucial for patient recovery and trust. Poor management can lead to infections and delays, affecting outcomes. Electricity, water, and HVAC systems are essential for hospital operations. Continuous monitoring ensures stability and prevents disruptions. Hospitals must maintain fire alarms, exits, and training programs to protect patients and staff. Organized response is crucial for vulnerable patients. Biomedical engineering teams ensure medical devices are inspected and maintained regularly. This supports patient safety and healthcare quality. Proper lighting, ventilation, and sanitation are vital for patient and staff safety. Managing hazardous materials is also crucial. Security measures and team responsibilities ensure safe healthcare environments. Strong coordination is essential across all departments. Hospitals must be ready for various disasters, from fires to pandemics. Preparedness strengthens resilience and ensures safety. Effective emergency response involves multiple teams working together. Coordination reduces chaos and improves preparedness. High-risk areas require specialized evacuation protocols. Proper resources and trained staff ensure safe patient movement during emergencies. Managing infection control and environmental cleaning is crucial. The COVID-19 pandemic highlighted the importance of preparedness systems. Digital alerts, AI monitoring, and communication platforms enhance emergency response. Smart infrastructure strengthens preparedness and response speed. A hospital's response to unexpected power failure demonstrates effective preparedness. Coordination and quick action maintain safe operations. Regular inspections and preventive measures ensure operational reliability. Identifying technical problems early prevents major failures. Hospitals must meet compliance requirements to ensure safety and reliability. Accreditation influences outcomes and operational readiness. Training ensures staff respond effectively during emergencies. It strengthens organizational resilience and patient safety. Facility management improves safety, comfort, and trust. It directly influences patient satisfaction and healthcare quality. Adapting to climate risks, cybersecurity threats, and growing demands is essential. Continuous evolution ensures quality management. Trained healthcare professionals are crucial for effective delivery. Continuous development ensures operational safety and quality. Explore how structured competency frameworks, continuous training, and robust HR quality systems build and sustain a high-performing healthcare workforce. Despite advanced technology and strong policies, healthcare quality ultimately depends on the people delivering care every day. Clinical staff, coordinators, admins, and support teams all play crucial roles in ensuring patient safety and effective healthcare operations. Staff competency encompasses the knowledge, skills, and behaviors required to perform healthcare responsibilities safely and effectively. It's crucial for maintaining patient safety and healthcare quality. Human resource quality systems are vital for recruiting, training, and developing healthcare professionals. They ensure systematic improvement in organizational reliability through recruitment, credential verification, training programs, and performance monitoring. Recruiting qualified professionals with the right education, certifications, and skills is essential. Effective hiring decisions directly influence patient safety and operational efficiency. Credential verification is crucial for patient safety, ensuring healthcare professionals meet legal and professional standards. It involves licensing, education, certification, work history, and competency validation. Orientation programs help new employees integrate into healthcare settings safely by covering policies, infection control, workflows, and patient safety standards. Continuous training in healthcare is essential to keep up with evolving technologies, regulations, and standards. It strengthens healthcare quality through infection prevention, emergency response, digital systems, patient communication, and documentation. Regular evaluation of clinical skills through observation, simulations, audits, and performance assessments is crucial for maintaining patient safety and operational standards. Effective communication is key in healthcare, influencing patient understanding and comfort. Training in patient-centered and team communication is increasingly important for competency development. Leadership training for healthcare supervisors and future leaders is crucial. It enhances decision-making, teamwork, and quality management, creating a positive healthcare culture. Regular monitoring of attendance, competency, patient feedback, and training completion is essential for maintaining accountability and identifying improvement areas in healthcare. Healthcare environments can be physically and emotionally demanding. Supporting mental health, preventing burnout, and building workforce resilience are crucial for maintaining performance and patient safety. Effective healthcare delivery relies on collaboration among doctors, nurses, pharmacists, technicians, and administrators. Training in teamwork and interdisciplinary coordination enhances patient safety and operational efficiency. A real-world example shows how targeted training systems enhance emergency response coordination, significantly improving staff confidence and performance during critical situations. Digital learning systems are reshaping healthcare workforce development, making training more accessible, consistent, and measurable than ever before. Accreditation bodies review staffing qualifications, training records, competency assessments, and performance systems to ensure healthcare organizations are prepared to deliver safe care. Professional competency includes honesty, confidentiality, respect, accountability, and ethical decision-making. These values strengthen patient trust and organizational reputation. Effective workforce planning involves managing staffing levels, competency systems, workload, and scheduling to ensure patient safety and care quality. Healthcare professionals must continuously update their knowledge and skills to keep pace with evolving medical knowledge, standards, and patient expectations. Modern healthcare relies on electronic medical records, telemedicine platforms, and cybersecurity systems. Understanding these digital systems is essential for quality management. Explore how digital transformation is reshaping healthcare quality, patient safety, and operational excellence in modern hospitals worldwide. Modern hospitals now depend heavily on digital systems to manage patient care, communication, documentation, diagnostics, billing, scheduling, and healthcare quality operations. Healthcare information systems are digital platforms used to collect, store, manage, and exchange healthcare data across hospitals and healthcare organizations. Electronic medical records, commonly called EMRs or EHRs, allow healthcare providers to access patient information quickly and securely. Healthcare technology helps reduce medication errors, duplicate testing documentation mistakes, and communication failures. Hospitals increasingly use digital dashboards and analytics platforms to monitor infection rates, patient satisfaction, emergency response times, operational efficiency, and quality indicators. Telemedicine allows patients and healthcare providers to communicate remotely through video consultations and digital communication platforms. Digital systems align consultations, surgeries, diagnostics, and rehabilitation sessions with staff availability. Healthcare organizations store highly sensitive patient information including medical histories, financial data, diagnostic reports, and personal identification records. Patients expect hospitals to protect confidential medical information securely. Healthcare organizations must follow privacy regulations, access controls, and encryption protocols to maintain confidentiality. Hospitals increasingly use AI to diagnose patients, monitor conditions, optimize scheduling, and operational management. Patients increasingly expect fast communication through emails, mobile apps, online portals, telemedicine systems, and automated updates. Managing policies, SOPs, audit reports, training records, and accreditation documentation manually creates significant operational risks including version conflicts, lost records, and compliance gaps. Hospitals increasingly use automated monitoring systems for infection surveillance, biomedical equipment performance, environmental safety, and patient risk detection. A hospital experiences delays in outpatient coordination and diagnostic scheduling, causing patient dissatisfaction. Healthcare professionals must understand electronic records, telemedicine platforms, cybersecurity practices, digital reporting systems, and healthcare software applications. System failures, cybersecurity breaches, and connectivity issues can significantly disrupt healthcare operations. Healthcare accreditation bodies increasingly assess cybersecurity controls, digital documentation systems, electronic records management, telemedicine quality, and healthcare information governance. Healthcare organizations can now collaborate internationally through shared medical records, virtual consultations, remote diagnostics, and digital healthcare networks. AI systems, robotics, predictive analytics, smart infrastructure, wearable devices, and remote monitoring technologies will continue transforming healthcare operations. Even with advanced technology, hospitals must ensure documentation compliance and accreditation success to maintain operational excellence and patient safety. Welcome to Chapter 14, where we delve into preparing for accreditation surveys and inspections. This chapter provides a comprehensive guide to building accreditation readiness through continuous quality improvement, staff education, and organizational excellence. Accreditation doesn't happen overnight. Successful healthcare organizations continuously improve policies, patient safety systems, and staff competency. Accreditation readiness depends on a sustained quality culture across the entire organization. Accreditation surveys assess whether hospitals follow healthcare quality standards during daily operations. The focus is on real operational performance, not just paperwork. Surveyors evaluate patient safety, infection prevention, and staff awareness. Hospitals must understand specific accreditation standards related to patient care, documentation, and leadership. These standards are the first step toward accreditation readiness, ensuring compliance with required expectations. Conducting gap analyses helps hospitals identify weaknesses by comparing current operations against accreditation requirements. Early identification of gaps improves preparation efficiency significantly. Accreditation surveys require organized and updated documentation, including policies, incident reports, and audit findings. Ensuring documentation is current and accessible is crucial for improving compliance readiness. Staff awareness is vital for accreditation success. Surveyors evaluate staff understanding of hospital policies, patient safety systems, and emergency procedures. Continuous education strengthens readiness. Internal audits help hospitals evaluate compliance before official surveys. They identify operational weaknesses, documentation gaps, and training needs, improving organizational confidence and preparedness. Mock surveys simulate real accreditation inspections, helping hospitals evaluate readiness under realistic conditions. They identify gaps and improve performance before the official survey. Leadership plays a crucial role in accreditation readiness, ensuring resource allocation, quality oversight, and communication. Strong leadership enhances readiness scores and fosters a culture of quality throughout the organization. Patient safety systems are critical during accreditation. Hospitals must demonstrate consistent, reliable safety practices across medication safety, infection prevention, and emergency preparedness. Accreditation readiness requires effective coordination between clinical, quality, and administrative teams. Strong communication improves operational consistency during surveys. Surveyors evaluate whether hospitals maintain a strong safety culture, teamwork, and professionalism. They often identify strengths and weaknesses through staff behavior and interactions. Hospitals implement corrective actions to address compliance gaps and improve systems quickly. Continuous improvement supports accreditation success. A hospital's journey toward international accreditation involves comprehensive preparation, from gap assessments to mock surveys. This case study highlights the steps taken to achieve accreditation successfully. Surveys inspect fire safety, biomedical equipment, and utility systems. Hospitals must demonstrate safe and reliable infrastructure management to achieve accreditation. Digital systems enhance accreditation readiness through compliance dashboards, electronic documentation, and AI analytics. Technology improves quality management significantly. Confident staff perform better during inspections. Continuous education, mock interviews, and feedback build confidence, enhancing survey performance. Accreditation should be part of a long-term quality culture, not just a temporary project. Continuous audits, training, and leadership engagement support healthcare excellence beyond inspections. Accreditation preparation strengthens communication, documentation, and accountability across healthcare organizations. It should be part of everyday operations, not just inspection periods. As accreditation grows globally, trained professionals in quality management become valuable. This chapter explores career growth and certification opportunities in healthcare quality management. Explore the journey of career growth and professional certification in hospital quality management, guiding you from foundational roles to global leadership opportunities. Healthcare quality management is rapidly expanding as hospitals focus more on patient safety and compliance. This field is becoming essential in modern healthcare systems worldwide. Quality professionals play a crucial role in supporting safer healthcare systems by managing patient safety, compliance, and risk management. Their work directly impacts healthcare reliability and efficiency. Career opportunities in healthcare quality management span hospitals, clinics, consulting, and international organizations, offering diverse pathways for professionals. Common roles in healthcare quality management include executives, coordinators, and safety officers, each contributing to the improvement of healthcare systems. Accreditation expertise is highly valued in healthcare, enhancing employability and career advancement opportunities through knowledge of key frameworks. Strong communication skills are vital for professional growth in healthcare quality management, enhancing teamwork and leadership potential. Analytical thinking is crucial for quality improvement in healthcare, aiding in audit analysis, KPI monitoring, and incident analysis. Leadership opportunities in healthcare quality management are expanding, offering roles from coordinators to directors, supporting strategic governance. Technology skills are increasingly important in healthcare quality management, involving digital audits, analytics, and electronic medical records. Continuous learning is essential in healthcare, ensuring professionals remain relevant and effective as systems evolve. Professional certification builds credibility in healthcare quality management, demonstrating commitment to standards and continuous learning. Healthcare quality careers offer global opportunities, with roles in international hospitals, networks, and agencies. Teamwork and professionalism are key to building a strong reputation in healthcare quality management, fostering collaboration and reliability. A real-world example shows how healthcare quality management can lead to career growth, from supporting audits to leadership roles. Healthcare consulting is a growing opportunity, offering services in accreditation, infection control, and quality improvement strategies. Emotional intelligence enhances professional effectiveness in healthcare quality management, supporting better leadership and collaboration. Future healthcare careers will be more technology-driven, with advancements in AI, predictive analytics, and remote healthcare systems. Healthcare quality professionals improve entire organizations by enhancing patient safety, operational efficiency, and compliance performance. The future of healthcare quality is expanding, with increasing demand for accreditation, digital tools, and global networks. Get professionally certified with CDG training to advance your career in healthcare quality management, offering flexible online learning and certification.